Pathway. Now, we've talked a lot about pathways. I think in various discussions this morning, this afternoon, we've talked about pathways. And I'm conscious that a pathway might mean something to the doctors. It might not necessarily mean something to everybody here. There are different sorts of pathways, and we might talk about a pathway for people with diabetes, or a pathway for people with chronic obstructive pulmonary disease, or for asthma. And historically, these pathways have often been very clinical, very medical, about a disease, and not so much about a patient. A pathway to us as clinicians is a series of steps that outlines getting someone with a long-term condition usually, but it doesn't have to be. It could be someone with a heart attack. It's about getting them from being unwell to being well. It's also about lots of agencies and people working together, whether that's your nurse in primary care, nurse and doctor in primary care, a specialist nurse, a specialist heart failure nurse coming out from the hospital, or the hospital itself. One of the things we want to talk about is who the pathway belongs to, whether it's the system, whether it's the doctors, or whether it should be the user that the pathway belongs to, whether it's paternalistic, whether you're being told what to do, or whether it's in partnership, and whether or not it involves empowerment, whether we actually are empowering you, the service user, to actually feel they have control over the service that you're experiencing. So this brings us to Kenneth. Now, Kenneth is a Vale of York Clinical Commissioning Group name for an imaginary patient. He's based on a real-life person who had a fairly horrific experience and died. We decided that that's all we're really going to say about Kenneth, the real person, because Kenneth has given us some inspiration in terms of how we make what we do better, how we make services better for the users. And what it means is that in the first instance, we're going to involve service users in service design. So basically, when we're talking about redesigning a cardiology pathway, we'll be talking to patients with cardiology conditions. We're going to talk about a patient-centred approach. Now, clearly talking to individuals, talking to patients is very important for that, but you can have a patient-centred approach without actually having a patient in the room, and Kenneth helps you do that. Kenneth is our anglicised version of a Swedish lady called Esther. Now, in a place called, it's spelled John Coping, but it's pronounced Jönköping in Sweden, they produced this Esther model of care. Now, in Sweden, Esther is an 84-year-old woman who lives on her own, who has family living locally, she has long-term conditions. What they do is, whenever they design or think about a pathway, they say, what does that mean to Esther? How would Esther interact with that pathway? And they walk Esther through the pathway. Now, obviously, if it's a pathway involving children, then it'll have to be one of Esther's grandchildren or something like that. So they've used this pathway to make sure that they're all the time patient-centred. They're all the time thinking about, what this means for Esther. Now, for us, we wanted to adopt that model and use that for when we're planning for future development. So we haven't actually used Kenneth in anything yet. But we decided that Esther, lovely name as it is probably not something that we wanted to copy, it's just a straight copy. So we decided to come up with our own name, and it was one of the doctors at the hospital who had told us about this man Kenneth's experience that touched us all so much that we felt actually this is a good way of making something good happen out of that experience. So hence, we will be applying Kenneth and Kenneth's family through any pathway that we develop in the future, as well as speaking to real patients. But this is just another way of putting the patient at the centre of things. It's a virtual patient, but it just helps us focus our mind and attention onto why we're doing things, and to hopefully provide the best possible pathway for the Kenneth.